Hi, my name is Sarah, and this is going to be my demonstration of how to change a dressing. So, the first thing that you need to do is to perform hand hygiene. So, I have some hand sanitizer here. Next thing you want to do is ensure the patient's privacy. So if they're not in a private room, you would want to close that curtain. The next thing that you want to do is to verify the provider's order. So just go in the patient chart and verify the patient's order. Next, you want to introduce yourself. So, hi, my name is Sarah. I'm going to be your nurse today. Next, we want to make sure that we just have the correct patient and we're doing the right procedure on the right patient. So, how you do that is you want to use two different identifiers. So, you'll just look at their wristband and ask them to tell them to you your their name and date of birth, and it should match what is on the wristband, so you know that you have the right patient and you're doing the right procedure on the right patient. So the next thing that we can do is just kind of explain what's gonna happen, what they can expect. Also a good time to assess their pain level. So just tell them your doctor you just need a dressing change. So we can assess that wound, make sure there's no signs of infection or anything like that. Assess their pain. They can do it on a scale from 1 to 10. Usually you want to administer pain medication 30 minutes before. That way they're just not experiencing as much pain, because this can be painful if they have a large wound. Next thing that you would need to do, if you think that you're going to be sprayed during the procedure, it might be good to put on the appropriate PPE. I don't think that's necessary for me today, so I won't be doing that, but you can, and it'd be a good time to do it if you're going to do it. Next thing you want to do is just kind of position the patient comfortably for both the patient and you. So I'm a little tall, so I would want to raise the bed so I'm not like hunched over or have back pain while I'm doing this. So I want to raise the bed, make sure that they're comfortable. I only want to expose the wound and not like their whole body. So I'm gonna go ahead, lay some tissue on my bear here so he feels comfortable. And ask the patient not to touch the wound or touch any of the sterile equipment as well. So now that we've kind of prepared for a procedure, I'm going to go ahead and lay out my biohazard bag. I have all my supplies on a table right next to me, so you need to make sure that you got all your supplies as well in the beginning. So let's see. I'm going to open my wound care tray and just get my bag. Just kind of want to flip over the coffin. I'm kind of working with limited space, so put it right there. Right, now you want to put on some clean gloves. They don't have to be sterile, but they do need to be clean. This procedure requires more gloves than I have, so I'm just going to say like when I need to change my gloves just because I only have one pair that actually fits me. So I'm going to go ahead and put on my gloves. We already did hand hygiene. Sometimes it takes a while. Okay. So first thing that we need to do is to remove the current dressing from the patient that is dirty. So I'll just kind of made my own like fake dressing type of thing. So there would be tape around your dressing to secure it. So you would first need to take off that tape. How you want to do that is you want to put your hand on the uninjured skin. Just kind of hold it there as you peel the tape off in the direction of their hair. This is just kind of cause less pain, hopefully. You can cut the hair if they do have a lot of hair. He has a lot of hair. Just based on your facility's protocols. So you'll take off the tape parallel to the skin. So when you're taking off the actual dressing, you want to be looking for the drainage, just kind of keeping in mind if there's a smell and odor, if there is any drainage, what kind of drainage does it look like does it have a certain color, is it thick, is it not thick, just stuff like that. And make sure that you're keeping it away from your patient's eye and kind of like containing it in the gauze. So put that in the bio. And then I also have some gauze. It's actually tissue. But you also, and just see if there's any drainage. Put that in there. And see if there's any drainage again. So now we have our wound exposed. I did put a little picture of a wound on my bear. I don't know if you can see that. So now what I need to do is to change my glove because now we're going to clean the wound. So I would put my gloves in the bio, and then I would need to do hand hygiene again and reapply some clean gloves. So to go back over here, and I just need to get my things ready so I can clean this wound. Or actually we need to assess the wound first, so let's just do that first. So assessing the wound with my clean gloves, you may just want to palpate a little, see if there's any swelling, reassess the patient's pain, just because it is open to the air, and we are kind of touching it, and hopefully the analgesic hasn't worn off yet. So you're just kind of checking for swelling, redness, drainage, if there's any signs of infection, swelling, things like that. This is also a good time to measure your wound if the doctor has ordered that. Yeah, so you just kind of want to assess everything. Assess the skin integrity as well, because you may need to change the dressing more often if there's too much like maceration. So now that I've assessed the wound, I need to change my gloves again. So I would take off my gloves, put them in the bio, bag and do hand hygiene again. And I would need to put on sterile gloves this time because we are going to be cleaning the wound and you don't want to introduce any bacteria into the wound. So we're going to place our sterile field. Now this table, it should be at my waist level, but it's not, but it's like the only thing I have. So we'll just pretend that it is at my waist level, because when you go below your waist, then your gloves aren't sterile anymore. So I have on my sterile gloves. I'm just going to grab my sterile field at the corner. Because the border is not sterile. My table's not really big enough for all of this. Okay, I'm just gonna pretend. Okay. We're just gonna pretend that would be like off to the side or something. So now what we need to do is kind of place our things just so we can clean the wound. So if you did need to measure your wound, this is what you would use. Measure it and put it in the bio. And you just want to keep in mind like what the measurements are. Or you could write it down too. So I have my sterile field placed. So I just need to take out my things. You don't want to reach across really. Try not to do that if at all possible. You don't want to get your sterile field wet either, because that contaminates it. Here would be my sterile gloves that I already put on because these don't really fit me. You don't want to put your back to the sterile field either. And then I have some normal saline right here, and I would pour this into my tray. And then once I've done that, I can, these are my pretend swabs or cotton balls, so I can clean the wound. So all you would do is put it in the saline, wring it out, and then you'll only use one stroke because you don't want to introduce bacteria like right back into the wound if possible. So you would just do like one side and throw it in the vial, and then just do that a few times, and then one side and do it in the vial. And you also want to clean from the cleanest to the dirtiest, and that goes in the vial. I'll dip it, wring it, and clean it again and put it in the vial. So now that I have cleaned my dressing, I am ready to put on I cleaned my wound and I'm ready to put on a new dressing. Now, based on the type of dressing that you're doing, you can either do dry or you could do wet to dry. I'm going to be doing dry because I can't really pack my wound. But if you could pack your wound, you would just soak this gauze into the saline And then you would just kind of pack it in with these Q-tips. You just like, so how that works is, so as you're putting like part of the sheet into the wound, you just kind of push it down into the wound. You don't want to pack the wound too tightly though, so just keep that in mind. So if I was doing a wet to dry, I would do that. I don't really have a way to like pack this because it's just a picture. So I'm just going to do a dry dressing. So the first thing that I need to do would be to put on like a contact layer of the gauze. So I have some dry gauze here. I'll just put that over the wound and put a couple. So now after I place that loosely, I can place my gauze pad over the wound. So I have that there. So now I need to secure my dressing. So to do that, I would just tape all sides of it down with this tape. And I can actually do that part just to, save my equipment. It's really hard to get tape off this bear. So I would tape right here, just on all sides, so it's not going to move anywhere, and so it won't move anywhere, come off. That's what I'm trying to say. So once I put the tape on, I will write my initials and the date. Kind of just depends on the facility's procedures. So just write everything so they know when it was placed, who did it, what time and day, and all that. So they know when the next nurse comes on and knows if they need to change that dressing based on the time that it was last done. So now what I need to do is to clean up my area. So again, I would take off my contaminated gloves, do hand hygiene, and clean all of my contaminated things. So then I would just clean this all up, put it in the biohazard, and then do away with it properly. And then once I'm done with that, I would take off my gloves and do hand hygiene again. So just throw this away in like the regular trash, clean this all up, put in the bio, put the bio where it needs to go, clean my hands. And I would make sure my patient is comfortable. Ask him, reassess that pain again. Make sure I've lowered the bed that I raised. Ask him if he needs anything right now. Make sure the call light is within reach. The side rails are up for safety. Ask if they need anything, if they need to go to the bathroom. After I'm done, tidying up my area, making sure my patient is comfortable, I would document my wound assessment, the dressing change, all those things I was talking about earlier. If there's an odor, if there's an exudate, if there's a color or like a thickness, how the patient tolerated the procedure. And that would conclude the dressing change. So You also would want to kind of later on, maybe like in 30 minutes, just kind of check on the dressing. Make sure that it's not saturated. Just make sure it's still there and it's not pulled off or anything like that. Just do like a follow-up, like check on it. So yeah, that is my video for changing a dressing. Thanks. Bye.